So, do you have OCD or is it just anxiety? I see a lot of things on social media around OCD, and I get a lot of questions in my practice. A lot of people will be like, yeah, that's just my OCD. Okay, well, let's dig into it a little bit. I'm Kathy Shorman. I am a licensed clinical professional counselor. I'm a trauma expert and a certified neuro-linguistics programming practitioner. I'm also the owner of Monarch Therapies, and we would love if you would visit our website, give us a call, send us a message so that we can help you on your mental wellness journey. So, anxiety, normal brain function. Let's just put that out there. If someone tells me they've never had anxiety, I'd be really worried because they're either dead or they're just lying. Because our brain is designed, think of it like we've got this alarm system constantly going on in the back of our head. And it's constantly searching for worst case scenario or what could go wrong. And when we feel that, when we notice that little, "Oh, what's going on?" That's anxiety. Now, anxiety can get to a point where it is more like controlling your behaviors in your life. That's when anxiety gets to the point where maybe you need to talk to someone about it. Um, OCD, and we're going to talk about the difference between the two, but they both have like those thought loops, those constant worries, that hypervigilance or hyperreactivity. So both are present in just your normal generalized anxiety as well as OCD. The difference, let's talk about anxiety. When someone is experiencing anxiety to a level where it meets criteria for an anxiety disorder, or maybe to the point where they need to seek professional help for their anxiety, is when the looping thoughts, the hyper awareness, the even that it's a somatic, like muscle tension, is to the point where like it's interfering with your ability to get things done. That the anxiety, the worry that you have is taking away from your ability to show up as your true self. So that's when you need to think about talking to someone about it. OCD, on the other hand, obsessive compulsive disorder. It's born out of anxiety. However, there's usually an O, something that the person is obsessed about, that their thought loops keep spiraling on. Whether it's the health and safety of their family or um, embarrassment or whatever it is. And then the C, the compulsion, is a behavior or an activity that they feel compulsed to do in order to relieve the anxiety from the obsession. So someone might be concerned, might be obsessed about getting ill. And so they, every time that anxiety, that thought spiral is triggered, then they're compulsed to go wash their hands over and over again. Or maybe they're obsessed about the health and safety of their family, and so before they leave the house, they must check every lock, make sure every light, make sure everything is turned off, because what if the house burns down? And so they repeat those behavioral patterns over and over in order to quell the anxiety. The other thing about OCD is a lot of times there's intrusive thoughts. That goes along with the O, the obsession. Now, don't get me wrong, everybody has intrusive thoughts. I had someone once say, "Oh, I'm having intrusive thoughts. I must be OCD." No, everybody's got intrusive thoughts. Think about it. Have you ever had that person that you really don't like and they're standing a little too close to the edge of the deck or the patio and you're like, "What if I just..." Okay, but you don't do it. But that's an intrusive thought. It's an unwanted thought that makes you go. And when someone has OCD, those intrusive thoughts spiral over and over and over again. to the point where they have to. They're compelled to do a behavior in order to alleviate the anxiety from that. Okay. So I hope that I've been able to, one, normalize anxiety, because remember, total normal brain function, and give you a little bit of insight into when it is something that you need to seek help for, and the difference between a normal anxiety reaction and when it's more serious, like OCD. So if you have any further questions or you want to continue the conversation, visit our website, give us a call, send us a message. Really like to hear from you. And as always, I see you. I love it. And I'll talk to you later.